support services. And the crux of my work really sits at kind of the intersection of public health systems, mental health policy, and lived experience leadership. My path through public health really was very nonlinear and was very much driven by lived experience through serious mental illness, psychosis, and for much of my life being somebody that was actually navigating those systems, just really kind of trying to survive. And over time, I feel like those experiences for me kind of evolved from personal struggles to really trying to see how complex systems can be made better for people that are also living with things like schizophrenia, bipolar, other SMIs. And I really wanted to move from someone being somebody who navigates those systems to being someone who co-creates ways to redesign those. And I feel like my view and experience doing that has really been shaped not only through my professional role, but through my doctoral program at Tulane, where my research is focusing on the impacts of lived experience with SMI on state level mental health policy, innovation, and sustainability. And like leading into my work and impact, I feel like I've really had a good privilege to support the oversight of these different programs that I'm doing that, not only distribute millions of dollars in funding across our regional behavioral health systems, but really work towards strengthening accountability, expanding community-based care, and really ensuring that resources and programs and funding are really going to people that are historically underserved in mental health communities, especially those that are like chronically homeless or criminal legal system involved. And at the same time, I think my involvement through organizations like NAMI and Aves Mental Health have really helped me kind of shape national and global initiatives that elevate lived experience as a form of discipline, kind of like clinical work, public health practice, and research. And kind of some key accomplishments, I think, despite living with SMI, I think I've been able to build a flourishing life. I'm a first gen student, soon to be first doctor in my family, actually in about 7 months, and been honored to receive a national training fellowship through the RWJF's Health Policy Research Scholars Program at Johns Hopkins, which has really kind of helped strengthen my own academic training and leadership in health policy and specifically in mental health equity. I've also been able to foster, different research and global collaborations, having recently published in Nature Mental Health outlining ways that the NIMH can further embed lived experience in psychiatric research. And so overall, I think that, this, role in this award would help amplify my work by continuing to expand the platform for lived experience leadership within public health. Thank you.
Thank you very much, Alex. That was great. We're going to go on to the next person, Alton Reed. Also, I want to share that once we get to about 15 seconds, I will be unleashing the cat reactions so that you can know to sum it up. Alton, you should be appearing as a panelist once you share your video. Yes. Welcome. Let me redo the timer for you. Once it starts, you're more than welcome, and we look forward to hearing.
No problem. Okay. Hello, everybody. My name is Alton Reed. I'm currently a CMS employee, which is the Center of Medicare and Medicaid Services employee within the Department of Health and Human Services. Prior to that, I was at the EPA as a health scientist. I was a VCU 10 under 10 honoree in 2023, and I was a Drexel 40 under 40 honoree in 2024. A lot of my work works within CMS. We do a lot of data aspects with things like data enrollment and payment data. So essentially, I'm looking through the trillions of data and making sure that the data is correct for getting Medicare and Medicaid services to people through APTC subsidies. A lot of my work is on the national level, which makes sense from the federal government. And generally speaking, I tend to put myself in federal spaces because of how my lifestyle before I got into the government was. And I think it's a big reason why I would be great for the award. I try to make a positive impact wherever I go. And I'd make that kind of like the crust of who I am to try to always bring the best out of a program when I'm there. When I was younger, I lost my father, unfortunately, to gun violence when I was about 1 month old. And I was raised by a single mother who was a Jamaican immigrant. She and I were going back and forth between New York and Jamaica a lot. So I've always dealt with communities and kind of like always had this mindset that I always want to get back to them, which has helped me throughout my life because I went through medical school at one point, but then I transferred over and went into health policy. I'm currently a DRPH student within Rutgers University, and a lot of my work has to do with tropical nations and giving back to tropical nations in the sense of looking at their programs and trying to improve the Northeast region based on programs that are going on with like climate initiatives and such. After I went to medical school, I came back to the United States and I actually ended up going to Drexel University, which was part of the Home Preservation Initiative. I presented at that in 2022 in Boston, actually, for APHA. During that time period, I was working with Mayor Kenny, and I was working with Drexel to get academic information and just go to different neighborhoods and communities and just asking them questions about what was going on and how their homes being rebuilt was impacting their health. Got such good data, and I felt really, really great just kind of taking people's like lived experience and then going and able to pitch it successfully to the mayor. We actually ended up getting grant funding through that program. Uh, I ended up doing that, and then I went to the EPA where I started actually saying like I think we can make a difference if we work with the federal government, and maybe there's a way to do that. And I did so in the OIG. I actually got the Gold Medal of Exceptional Service for my work in scientific integrity with dicamba in around 2023, which is the highest honor you could get within the EPA and in the nation in the sense of like the federal government where you make big impacts with something. I was the lead health scientist when I actually presented to the Federal News Network, and I was talking like policy and all these other things and like people in Congress. And we basically had an issue where there was concerns with scientific integrity and scientists not having a voice and their policies basically being rewritten in the government at that time period. We were able to find data with the EPOIG, and we were able to get that successfully like passed. And generally speaking, I just think, just to wrap up, I think I'd be good for the program because I think eventually I want to get to the CDC, NIH, and I feel like the program would be good for me to like learn and kind of grow through it.
Thank you very much, Alton. That was great. Sorry, the cats were a little late in being unleashed, but we will be bringing on our next person, which is going to be Bridget Martin. Bridget, I'm going to promote you to panelist. Once you have your video on, you're going to be showing on the screen. You are. Hi, welcome.
Hi.
Let me start once I start, you're going to be ready to go.
Okay.
I look forward to hearing.
Okay. Hi, my name is Bridget Martin. I am currently in Vermont, sunny but snowy actually in Vermont. I'm a trained physician. I have a Master's of Public Health from the George Washington University. And whilst I was at the George Washington University, I did a systematic review on the effects of antineoplastic, which is anti-cancer drugs, on the health of nurses. And I was able to identify that nurses were at higher risk of developing infertility when exposed to anti-cancer drugs. And the disparity was pretty much higher in places where they had low resources. And so one of the things that I also did whilst I was at the George Washington University was write a lot of blogs. I wrote blogs on the effects of PFAS on the human health. I wrote blogs on the effects of BPS on male fertility, male infertility. My research at the George Washington University on nursing I got an award. I got the award for the best research in my field in terms of health research. I also was able to present this research at APHA last year in 2025 and the International Society of Environmental Epidemiology as well in Atlanta. I'm actually working as a reviewer for the International Society of Epidemiology. One of the things that made me want to be part of the PCPH is because of the fact that you give training and you give a voice to people that are so passionate about public health. And currently in Vermont, I work as a HAB and substance use counselor, but I am not focused on counseling as much as I'm focused on public health. And so I'm taking data on a PHQ, a public health questionnaire, and the generalized anxiety disorder. And I'm trying to see if there's a co-occurrence between people that use fentanyl and cocaine and people that have high PHQ scores. And so we're trying to see that if there's a correlation between high PHQ scores and fentanyl and cocaine, what can we do in the interim to reduce their score? And our prelims, we're seeing that patients that have really low scores of PHQ usually become sober faster. And so this is something that we're trying to put an intervention in so that we can block people from, staying in clinic for so long without becoming sober. So this is one of the things that I'm actually doing in Vermont. And also on the side, I work with MedStar Health. I do the COOP study. We're trying to see if we can reduce the risk of colonoscopy side effects such as bleeding, death in individuals aged 65 to 82 years. And so we are doing data entry, we are doing screening, trying to see if doing a stool test is better than just going directly into colonoscopy every other year the person has polyps. And so one of the things that I see in myself is someone that I have practiced clinical medicine. I have seen how clinical medicine help people, but I have also seen that if you do public health, if you meet people where they're supposed to be at, help them get better before they get to the clinic, you have a higher chance of, getting them to get better. So that's part of the reason why I want to try. Thank you.
Thank you. Thank you very much. The music's starting to play. So next up is Marissa Robinson. Very nice. I'm going to put you back to being a panelist. There we are. Marissa, once you share your camera, you'll be live on the screen.
It's only allowing me to unmute. Oh, let me see. It's not giving me a camera option.
Okay,
It's only my microphone.
Okay, hold on. You should be able to do it then. Thank you
I'm
so
here.
much. Sorry for that. That's online. That's
No
online.
worries, no worries.
So let me reset the timer for you.
Okay.
And once I hit start, you can begin and we'll be ready to listen.
Okay. So hi, everybody. I'm Dr. Marissa Robinson, your sexual health girly, and I'm a public health practitioner. And public health often talks in numbers, and behind all of the statistics, there are persons of lived experience, full families and communities. And in the US, Black women make up about 13% of the total population of females, and yet we account for more than half of new HIV diagnoses among women. And that gap between what we know and who actually benefits from exactly where we can do better is where my work sits. So I'm an infectious disease researcher, public health educator, and policy strategist based in the DMV. I am the founder and principal consultant of Real Health Impact LLC. I am also a mentor and adjunct professor at GW Milken Institute of Public Health. And I have spent more than a decade in the federal space across HHS, CDC, HRSA, academia, and community partnerships to turn research and policy into strategies that actually reach those most impacted. And through initiatives like the Ending the HIV Epidemic Initiative, I have helped convene federal agencies, researchers, advocates, and community leaders to center Black women in HIV prevention, care, and treatment. And meaningful public health solutions rarely happen in isolation. So they happen when people come together, identify gaps, share solutions, but also drive systemic change. And that's exactly where I sit. I believe that public health isn't passive. It is us going to the people, to those of lived experience, putting the boots on the ground, not with our fans, but literally boots on the ground, and asking tough questions. We're rolling up our sleeves. We're implementing systems level strategies that can change, save lives, and increase well-being. So what I'm trying to really do every single day is translating not only research into community-centered education, but also mentoring emerging scholars, shaping policy conversations, and making the world a more equitable place. So across all my roles, my goal is very, very simple. It's to make sure that the communities most impacted by health inequities aren't included in the conversations, but they're leading it. So being a part of the 40 Under 40 would give me the chance not only to connect with other emerging scholars like the wonderful individuals on this call and beyond, but also committing ourselves to transforming systems and advancing solutions that are both evidence-based but also community-driven. So thank you again, and I'm so excited to be a part of this amazing opportunity and appreciate everyone's time today. Thank you.
Thank you very much. Lovely. So we're going to be moving on to the next person.
All right. And I'll just say, yeah, a collective thank you. I know we were moving quickly, but that's just for the sake of getting through things, but we are appreciating everyone's pitches.
Yes, yes. Please don't think that your pitches are going on deaf ears or that we don't appreciate what you're saying. At the next person is Dr. Oluwaseun. and I'm going to be promoting you to panelist. You'll then be able to see your video option, and once you make yourself live on video, we'll be able to reset the timer. Welcome. Oh,
Hi,
I'm sorry, I
everyone.
cut off your name. I called you by your first name.
That's okay. Thank
Let
you.
me push start.
All right. Okay. Good afternoon, everyone. My name is Dr. Oluwatosin Olateju. I'm originally from Nigeria and currently serve as a nursing professor at Coppin State University. I'm a public health nurse, a researcher, and policy advocate working to address some of the most pertinent drivers of health inequities, including food insecurity, infectious disease prevention, sexual health, and reproductive health for diverse populations. Across my work in the US and sub-Saharan Africa, my mission has been to ensure that where someone lives and their socioeconomic status should not determine their health outcomes. My path to public health. My journey started in my childhood days in Nigeria, where I accompanied my parents on trips to orphanage homes and villages to provide support and care to underserved communities. While caring for patients, moving on years later, in the US as a nurse, I saw many health challenges that people faced that were not only medical. They were shaped by structural inequities such as food insecurity, lack of preventive care, and limited access to health education. I realized that treating illness was not alone, alone was not enough, and improving health outcomes required changing the systems and policies to shape conditions that people live. So that realization led me to pursue a degree in public health. So I got my DRPH at Morgan State University, and I, continued working on strengthening public health systems. Over the years, I've worked at local departments, managing HIV, STI, Rhine Part B prevention, PrEP prevention, and family health programs. My work in nonprofit sector in 2019, I founded Food and Care for All that promotes food security and access to health education and access to healthcare for underserved populations in Maryland and sub-Saharan Africa. Currently, we're located in Ellicott City and we serve over 700 families monthly. The pantry opens twice weekly on Tuesdays and Saturdays. Throughout this work, I've implemented community-driven programs, nutrition, infectious disease prevention, chronic disease prevention, health education, and empowerment for young women here and in Africa. As the first Black co-chair and commissioner in the in Maryland for public health, I've contributed to statewide public health assessment and development of recommendations to improve programs and policies. I've also led bills that to promote HIV prevention and health equity, food security, and other topical areas. My key accomplishments here. I designed and led the first nurse-led HIV PrEP program in Howard County called OkoPrep. I've steered team to lead the passage of Senate Bill 251 back in 2017 that helps minors to get access to HIV prevention. My work has also allowed me to be recognized with several honors, including Teaching Excellence Award from Coppin State, Felisa Wilson Social Justice Award from the American Public Health Association, among others. Being recognized would really help encourage other young women, and it will be noteworthy. Thank you.
Thank you so much. That was fabulous. We're going to be moving on to the next person. I looked in the chat and I saw that someone thought they had been skipped. And what happened was that our last speaker, Dr. Oloju, I'm sorry.
Olateju.
It listed her as by doctor. I'm so sorry. Listed her as by doctor as her first name. And so it looked like we had skipped some people, but rest assured, please know that we know you're here. And I'm putting the list in the chat now in terms of order. So thank you so much. Yes, Natasha. I can understand that must have been a little unnerving. The next person to speak is going to be Colin Spears. I'm going to promote you to panelist. Welcome. Once you appear on screen, I'm going to reset the clock for you. Once you have if you could share your camera.
It's not giving me an option to share my camera at the moment. Are you able to hear me?
I can hear you.
Hmm.
Hmm.
Yeah, I just don't have an
You
option.
you were floating in the ether of Zoom, and I think I just fixed that. There you are.
Okay, am I here now?
Wonderful. So let me
Okay,
reset
thanks.
the thing. Please begin.
Thanks. Hi, I'm Ian Spears. I'm based in Burlington, Vermont, and I have a Master's of Public Health and am certified in public health and humanitarian medical logistics. I'm also an EMT and search and rescue technician and the co-founder and CEO of Pacto Medical. My work sits at kind of the intersection of public health, emergency response, and healthcare innovation with the goal of making sure that healthcare products can reach absolutely everyone. My path started when I was managing public health programs, supply chains, and emergency responses in Liberia and with partner organizations across Africa and the Middle East. And over the years of working with nonprofits and governments, I've been able to coordinate the delivery of over $100 million of medical supplies and over 3.4 million course treatments of medications across 18 countries now. I've also worked as an emergency management specialist for ASPR for over 5 years, supporting logistics for field hospitals during emergencies and disasters in the US. In a lot of those contexts, what I realized was I was watching healthcare systems and public health programs struggle, not because the right medicines and supplies didn't exist, but because systems were often failing to deliver them at the right place, at the right time, in the right quantity, or even at the right price. And those experiences really made something clear to me, which was that when we're trying to pursue health equity, we have to also make sure that we're fixing the supply chains that are working to connect those communities to the care that they're seeking. And so based on all of that, I founded Pacto Medical and invented a compact pre-filled syringe. I always have one on my desk. And what that does is it shrinks the packaging footprint of a traditional pre-filled syringe by 40%. And that has the goal of addressing really access by cutting transport costs and supply chain costs by 35%, by lowering logistics requirements, and by reducing emissions and waste associated with drug delivery. And the goal of that is to try to expand access to the benefits of pre-filled syringe drug delivery, as opposed to using vials and ampules, because pre-filled syringes they're safer, faster, more accurate, more sterile, all sorts of wonderful things, but we have to be able to get them to where they need to go. And we're really grateful that in 2024, the World Health Organization named us as one of the 10 emergency medical team innovation champions for the year. And now we've been able to scale this and starting to bring this innovation to different partner companies around the world. I think recognition through this award specifically would amplify the message that supply chain work is public health work and that addressing logistics challenges is really critical to achieving health equity. Thanks.
Thanks so much. And you made it right before the music started, so fabulous. Next up is Izzy Shahid. I'm going to promote you to panelist. To talk. Once you are visible on the screen, I'll be able to reset the timer and you'll have your 3 minutes.
All right, perfect. Thank you.
Here we go. Thank you.
Okay, so hi everyone. My name is Tessa. I'm a postdoctoral fellow working in cardiovascular prevention at Houston Methodist Hospital. So I'm from down Texas. And my work primarily revolves around cardiovascular equity and particularly studying how social and environmental conditions shape cardiovascular disease risk, which is my primary area of interest. A little background about me, I graduated from medical school in Pakistan about 3 years ago. And that is where I saw, I think, firsthand how a patient's health was determined, not just by biology, but by where they lived, what resources they had, and whether they could even access care. But, I also began to realize that these inequities don't just exist in the real world. They are often reflected in the science that guides our care in the first place. So my early research focused on healthcare disparities within cardiovascular science, studying inequities in research funding, trial representation, and treatment patterns. This includes some of the work that highlighted disparities in NIH funding, authorship in major cardiovascular trials, and also clinical trial enrollment. In particularly, some of the work that we did highlighted that women were very much less likely to receive funding and grants, be authorship in major trials, and also be less likely to enroll in clinical trials that actually lead to translational research where we know whether we are accepting or rejecting a drug. So from there on, my work expanded to social determinants of cardiovascular health, which is basically how neighborhood vulnerability, socioeconomic status, and structural inequities influence cardiovascular risk. And more recently within our lab, I've begun exploring the cardiovascular exposome, which is essentially how environmental exposures such as climate vulnerability, pollution, and built environments interact with biology to shape disease risk. So this work primarily highlights where someone lives can influence their cardiovascular health just as much as traditional risk factors. But obviously, beyond publication, the goal of the work is to influence how we think about equity in cardiovascular prevention. So in terms of the impact of our work, some of this work, like our analysis examining disparities in representation of women and minorities in FDA-approved cardiometabolic drug trials, has since been cited in National Cardiovascular Clinical Practice Guidelines and also in American Society of Preventive Cardiology's practice statement on diversity in clinical trial enrollment. And more recently, my work exploring environmental vulnerability in women was also recognized through national honors, including the Young Investigator Award in Women's Cardiovascular Health by Mass General Brigham. So ultimately, my goal is to help integrate social and environment data into cardiovascular research and care so that preventive strategies can better reflect the realities that people live in. And I think an award like this can really help with that. Thank you so much.
Thank you. Thank you. Well done. I'm going to send you back to the attendees.
Just like last week, this is going to be very difficult. You guys, you guys came like, you're bringing it hard.
Yes, and just also just I must say I get so nervous for folks when they're starting and everyone is like doing a master class and like how to pitch. So fabulous work. Next up, we have Josephina Lin. I'm going to be transferring over here to present. And what a beautiful engagement in the chat, everyone. So. Welcome. So let me fix the timer so that it's no longer counting down.
Okay.
Welcome to go.
Good afternoon. I'm Josephina Lin, and I'm excited to join you from Boston, Massachusetts, in the United States. I'm a public health practitioner, researcher, and advocate dedicated to advancing mental health equity in Boston's historically under-researched neighborhoods. I work as a research communications and health equity associate at Harvard Medical School, where I expand access to preventive health services and culturally responsive mental health care through community-led approaches. I began my career leading clinical research in anesthesiology, where I realized I wanted to work outside the walls of the hospital, where people's health and wellness truly begin. My commitment to addressing structural barriers to care led me to work at a mobile health clinic, an innovative model of care that delivers services directly to where people live, work, play, and pray. The principle of accompaniment and walking alongside the communities I wish to serve animates both my professional and academic work, and I lead the design and evaluation of public health programs that really center community voice. One example of my approach is a youth mental health initiative I designed and implemented that uses creative arts and storytelling as tools for self-expression and wellness. This program has served hundreds of youth in Boston, a city where nearly 44% of public high school students report feeling persistently sad or hopeless, and mental health challenges have increased sharply in recent years, especially among Black and Latinx youth. Through this initiative, we created a youth community leadership council, hosted creative arts workshops for youth of color to foster social connection, and worked with community partners to connect youth with culturally responsive mental health resources. I'm also grateful to contribute to national evidence base for public health change, and my research has led to peer-reviewed publications and national presentations about community-based models of care. And I'm honored that my work has received recognitions, including the Excellence by a Young Professional Award through the Massachusetts Nonprofit Network, the Equity, Social Justice, and Advocacy Award at Harvard Medical School, and the Rose Service Learning Fellowship at the Harvard T.H. Chan School of Public Health. I'm most proud, however, of the impact of my work for Boston's residents, and I wanted to share the words of one young person that I worked with who said, "People don't usually give us teens in Boston a platform, so to be able to be part of this project is something really amazing." Being recognized as a Boston Congress of Public Health Catalyst would really amplify my impact, and if honored, I would take this recognition back to the neighborhoods that I serve to really elevate community voices and continue to uplift community-led health innovation. Thank you so much.
All right, thank you for that. You're muted, Cersei.
I'm so sorry. Musarat, you are next. I'm promoting you to panelist. Let me check here to see if sometimes it puts people in the Zoom ether and it doesn't. Musarat, you've declined. Okay, I'm sorry. It appears Musarat's here too. Be supportive. Next up is Sydney. I think next up will be Natasha Kulviwat.
Hi. Hello.
Talking is permitted. Okay. Someone got lost in the ether and I've been able to pull you. There you are. Oh, yes. Musara, hello. Welcome. Natasha, you'll be next. Please, I'm going to restart the timer. I'm so glad that we were able to get you out of the Zoom ether. I was like, oh no.
Yeah, I thought I got stuck.
You did. So here we are. I'm going to start 3 minutes, and when you're ready, we're ready to listen.
Okay, great. Hi, my name is Musarat Rahman, and I'm from New York City, USA. I am currently a city research scientist at the New York City Health Department, where I champion health equity research and evaluation with a focus on racial and gender equity in our priority populations. When I was in college, I initially studied to become a science teacher because of my love of biology. But after volunteering with Keep a Child Alive, an organization focused on providing HIV care and treatment to children in sub-Saharan Africa and India, I quickly fell in love with infectious diseases, and I knew that was my true passion. I interned for a nonprofit focused on delivering patient-centered care in under-resourced and low-income neighborhoods in New York City, and that's where I began to understand the eye-opening impacts that race, racism, and other systems of oppression have on the health of people and access to resources to live their best lives. So I've worked in the field of public health for over 15 years. I am the sexual orientation gender identity data lead, or SOGI data lead, in our agency for an initiative focused on standardizing the way we collect SOGI data within the health department, so we can move away from stigmatizing people for disease and health behaviors, and instead move towards collecting data to affirm and validate people's identities so they can feel seen and represented. I served as the principal investigator on 2 research projects examining healthcare experiences and service utilization. One focused on identity and access to affirming healthcare in queer women, and another focused on sexual healthcare utilization in bisexual people, both of which have led to peer-reviewed publications. I evaluated a citywide campaign called Bear It All, which encouraged New Yorkers to have open and honest conversations with their providers around their sex lives. And I populated New York City's first provider directory on finding LGBTQ knowledgeable healthcare, including primary care, sexual health care, gender affirming care, and HIV preventive care. I oversaw an initiative called Race to Justice, which is an internal reform initiative on normalizing, organizing, and operationalizing racial equity and social justice at the health department. I led strategic planning around diversity, inclusion, racial equity, and social justice for 1,200 plus staff. I also co-led the agency's Asian American and Pacific Islander Employee Resource Group, and I co-authored the first citywide report on the health of Asian American and Pacific Islander New Yorkers. Recognition would help me amplify the amazing and trailblazing health equity work that has been done in New York City, and hopefully I can serve as a subject matter expert for other jurisdictions who would like to share and learn best practices in advancing health equity within their agencies. Thank you.
Thank you very much. Thank you very much. Yes, and now it's playing the music. And finally, after a bit of confusion, we're going to have Natasha talk. Let me promote you to panelist.
Hi.
Fabulous. I'm so sorry for that.
Wait, no worries at all. I'm so grateful to be here.
So I'm going to reset the clock. And once you see it in my screen, you can start talking.
Okay. Thank you. Hi, everyone. My name is Natasha Kobiwa. I'm a second year at Harvard, majoring in neuroscience, and I've been conducting research on the neurobiology of suicide for 5 years and counting now. And a key finding of my research was I found evidence of a major blood-brain barrier disruption in the human brains of those who died by suicide. And this publication was one of the first in the field to elucidate a more neurobiological mechanism of suicide. And as a result, I received a first author publication in a peer-reviewed journal, in addition to conference publications and 2 other health-related posts. And I was very fortunate to have my research featured in major media outlets such as Forbes, Business Insider, Columbia, TikTok of over 6 million views, and also recognition through Science Talent Search, which is Top 40 Young Scientists, and the International Science and Engineering Fair. And this was also really crazy, but as a 15, 16-year-old, I was the principal subject of a Disney Plus and National Geographic documentary series that aired worldwide, where I spoke about my research. So growing up, I was very focused on research, just always in the lab, but I soon realized in college it was my duty to use my platform I was given as a researcher in more legislative advocacy. So this past summer, I've worked with the American Foundation for Suicide Prevention, was invited out to the Massachusetts Out of Darkness Walk to talk about my research to a crowd of thousands to hopefully help decrease stigma. I spoke at the Massachusetts State House for a bill hearing, and right now I'm also leading campus-wide initiatives because who else can make a better impact than a bunch of passionate college students? I'm editor-in-chief of the biggest Harvard neuroscience publication called The Harvard Brain, where I founded a column highlighting real mental health struggles and pairing these entries with peer counselors, because I want to publish stories and not stigma. And I'm also leading the Health Fluency Project, where we are creating culturally responsive mental health pamphlets for immigrants. And we're also translating health resources into 10+ languages and providing grants to undergraduates in Boston to carry out their mental health research. And recently, we've caught the attention of Massachusetts Speaks Coalition and was also awarded the Most Innovative Program in Health Literacy in the 23rd Annual Institute of Health Literacy Awards. But right now, personally, I'm volunteering as a crisis text counselor and serve as a certified clinical medical assistant. I know I'm young, but I'm so grateful to be here. I'm so passionate. And I think thank you 40 Under 40 for this platform, and hopefully like grateful to meet the rest of you and to hear the work you're talking about. But yes, thank you so much.
Thanks. You actually beat the unleashing of the cats. So great job. I'm gonna
Yes, thank you, Natasha. And yes, 40 Under 40, it is obviously like, you know, we want to celebrate everybody who is under 40. You know, so yes. Never too young.
So Nicole, you are next. I'm going to promote you to panelist.
The threads of our lives are woven together, and any injustice rips and tears at the very fabric of our existence. What affects one of us affects all of us. Climate change is a threat multiplier, exacerbating health inequities and contributing to geopolitical tensions and international instability. I work at the intersection of public health and climate change to positively contribute to peace-building initiatives and the health and well-being of vulnerable populations and the planet. I'm Nicole Ma from the US. I have a background in health and research work on climate change, breast cancer, gastrointestinal diseases, and other diseases. I'm also a biomedical instructor, community organizer, and activist. I have organized over 30 protests to advance health equity and participated in additional social justice protests to advance human rights. I've served as a US delegate for United Nations conferences in Egypt and Azerbaijan, with policy training occurring after being selected by Oxford University Climate Program. My climate justice and social equity colleagues chose me to deliver a statement to the Italian Minister of Environment and the United Nations Development Program. I've also served as the United Nations North American delegate, where my climate and health policies advanced to the 80th United Nations General Assembly, and as the delegate at the UN headquarters, where I was the only person from the US to speak, as well as the only person from North America to speak out of all the ambassadors and delegates there. During the pandemic, I biked over 490 miles to provide 10,000 meals for healthcare workers and created Supply and Protect Healthcare Workers, which has donated PPE to over 20 hospitals, aiding over 200,000 healthcare workers and disadvantaged populations in the US, Saipan, Micronesia, and Palau. I created Compassionate to help underserved jaundice newborns, co-created Reforesting for Peace, which empowered 5,000 youth to combat climate change, and created a fire support initiative after experiencing devastating fires in my own community. I've taught and created biomedical courses and programs for Johns Hopkins University and the University of Hong Kong, with some classes for students from Qatar and the UAE, with the UAE Minister of Youth recognizing my program. I was the only Johns Hopkins instructor chosen to co-create an AI system and use it in my class as part of a pilot program. I've been a United Nations World Food Forum speaker, presented my poetry at the event, and organized an international artistic showcase for the event. I believe research and the editorial aspects are important social justice and health equity tools and hold leadership positions to advance public health in this regard. I received a Johns Hopkins University National Teaching Fellowship and Award, been a double Drucker Laureate recognized at the Vienna Hofburg Palace, received the UC Davis Health Sector Award and UC Davis Global Poverty Alleviation Award, Next Generation Public Health Awards, UC Berkeley Social Venture Recognition, and Lady Problems Vote America's Foundation Award. Thank you.
Thank you so much. And then the music starts. Yes. I believe up next is going to be Sydney Chen. I'm going to, oh, you did that before me, Dr. Candace. So Sydney, I'm going to promote you to panelist. You should be able to talk as well.
Hi. Oh no. One second. Why is it so blurry? Oh, there we are. Okay.
So
I was
funny.
like, that would not be conducive to anything productive. Okay.
Okay,
Wonderful.
I'm going to restart. Welcome.
Thank you
I'm
so
gonna
much.
restart the timer.
Okay, wonderful. Thank you so much, everyone, for your stories. I've really enjoyed hearing about, we've got Dr. Olateju from Nigeria, but now she's in Maryland, Ian doing supply chain work, Dr. Robinson, working with sexual reproductive health. It's all so inspiring and also so incredibly personal to people. It's coming from your own experiences, it's coming from observed or lived experiences. And something that I've really taken on in my work is realizing the personal element of maternal and child health. Mothers who have to take care of not only their own health but their child's health that's a dual responsibility, and really it doesn't get talked about enough just because it gets swept under the rug as an expectation that mothers are fulfilling this role. And I come to you from Duke University. I graduated last May, which feels like it should be longer ago, but I guess not. I really enjoyed my time there, and this is where I found the environment that I hope to find at 40 Under 40, which is an environment of yes, and I think we can. I think that's something that's really inspiring about being a leader, is trying to find optimism when really the world tells you no. And this started for me when I went to Kisumu, Kenya in 2023. My co-founder, she's not here, but Malat Tensei, she's going to be amazing. She's already doing med school stuff. I'm taking the law route, but we're coming together in the middle. She is, her and I together, we went to Kisumu, Kenya. We realized that mothers struggle to attend appointments when they also have a child to take care of. This means that, according to the World Health Organization, 92% of maternal mortalities are actually preventable, which means that it's not about scientific advancement, it's about social access. So what we did when we found this issue is we really were able to work with hospital administration to create a child care program that's hospital-based and free for all mothers. Since then, it's been 3 years now, and we have served over 10,000 mothers and children at a rate of 88 cents per mother and child pair, because they always come in together. You're not having a 5-year-old walking down the street. So 88 cents, it's a very sustainable project, and we've been able to elevate it to the point where we've received recognition from the Paul Farmer Grant, the Davis Peace Prize as well over the summer, the Robertson Peace Prize as well, and I was so fortunate to be recognized as the DGHI, the Duke Global Health Institute's Undergraduate Leader of the Year. So what we're doing now is we're expanding to Rwanda. We're actually partnering with a lot of universities to incorporate this element of education. And I really, really am excited to have this opportunity to join 40 Under 40 for that amplification of work across the seas. I also think I have experience in law. I was with Our Children's Trust, which is a very, it focuses on constitutional rights to health and global warming or global climate change as well. So all these different perspectives really make me excited to join and to be here today. Thank you all so much. And I'm really looking forward to, being part of the community.
Thank you. The music, I have to say, makes me laugh every time. Nice job. Nice job. And we have our last final speaker on the screen here. Thank you. It's Udochukwu Iheichi. Welcome. I'm going to promote you as panelist.
Oh, there we go.
Yes, and I must say, I just saw in the chat, rock stars. That is very much the right word to describe today.
Hi, can everybody hear me? Yeah, okay.
Yes, yes. I'm going to restart the timer. Once you see it appear on my screen, you are welcome to start, and we look forward to listening.
Thank you. Hi, everyone. Good afternoon. Very inspiring hearing everyone's work. Just like Sydney said, my name is Udochukwu Iheichi, and I'm a physician and a public health professional. And this identity has actually shaped how I view healthcare in terms of health disparities. And it's one thing to see patients come into your examination room and to see the face of suffering, but it's another thing to see that suffering on a grand scale and to actually have the tools to dismantle the systems that cause suffering. And so my journey as a catalyst really began when I moved to the United States, transitioning from a country, Nigeria, where infectious disease is a burden, to a place where we are gripped with opioid crisis. That's actually shifted my perspective on how healthcare should be addressed. And it has really been moment defining for me. And so I just wanted to be a part of the solution to the opioid crisis, to contribute in some way. And today, as Deputy Director at a community-based mental health clinic, I'm actually bridging the gap between clinical excellence and grassroots harm reduction. And so with the work I do at the mental health clinic, it's actually, like I said, a grassroots harm reduction approach where we're addressing outreach, harm reduction training, doing quality control by receiving feedback from the members of the community, because I understand that, public health is about shared decision-making, community participation, and you just want to make sure that people in the community are involved in whatever you're doing. And so I work in a clinic that is located in Nubian Square, which is the epicenter for Boston's opioid crisis. And the statistics are staggering. In Boston, between 2022 and 2024, the life expectancy for Black males was just 71.8 years compared to 81.1 years in other races. And the number one cause of the 10-year gap that we see in life expectancy between among Black males is actually due to unintentional overdose. And so this is a problem. And so the work that I do leads, systemic changes to ensure that outreach workers go into the streets, because they are the ones that know the streets the best, and make sure that they are trained, they are empowered, they are integrated into our clinical decision making, because we're not just treating a diagnosis, we're also fighting high rates of incarceration and also family disruption that follows the epidemic. And so my work at Roxbury in Nubian Square is not just local, it's also of global relevance because it's creating a blueprint for how urban disparities can be addressed. And so I'm partnering with different organizations, providing naloxone, providing housing support, making sure that there's a pathway back to dignity, elevating voices that have been silenced. And so this award will definitely help me amplify the work that I'm doing and to make sure that, I'm mentoring people to see that there is a person behind the patient that comes to you. Thank you.
Thank you. That was wonderful. So thanks very much. It looks like we've exhausted our roster, but I just want to say this has been like just an incredible way to spend part of a Saturday with all of you and hearing about your incredible work. And I just can't also thank everyone enough for taking advantage of the chat to like engage with each other. It's been very inspiring. And so this is why we do the Boston Congress of Public Health, why we do 40 under 40. Dr. Carpenter, I'd like to hand it over to you. You haven't had a chance to really say anything today.
Oh, no problem. So if we could just give a collective round of applause to Dr. LeCompte, like DJ extraordinaire. I was trying to assist as much as I possibly could, but
oh, you were amazing. Thank you.
Yes, all of you have been wonderful. Obviously, we didn't get to a total of 40 people. I think I counted 12 on my list, if I'm not mistaken. We will be opening additional and at least one additional pitch day for North America as well as for Africa, for those of you who are watching online. So tell your colleagues as well, because obviously we want to get to that magic 40. But ultimately, like everything from infectious disease, maternal and child health, supply chain management. I love the incredible intellectual diversity within public health. And that's the other reason why we do the Boston Congress of Public Health, to be able to show people just how diverse public health is and how you can make an impact in so many different ways. So thank all of you for coming. And yes, we look forward to maintaining contact. Obviously, like once we make the awards, we will reach out to different individuals based off of this pitch, because we definitely do a number of different webinars and definitely invite several of you to be able to be speakers for our webinar series. So thank you.
Thanks very much. Oh, you know what, Dr. Carpenter, we have one person who's I know she was in a meeting and she's just hopped on.
Ah, okay.
We have an under the wire pitch, everybody.
Just under the wire. We were about to
under the wire. Oh my God. I'm so impressed. Dr. Schwen, I know you were in a meeting and you were you were burning the tires to get here. If you are ready to go, I'm gonna allow you to talk and have you present.
Hi, can you see me at all? Yes. Oh,
It just you're in the ether at the moment. You should be able to share your camera now.
join. Now I can.
Welcome. I know that you were booking it here.
I was booking it here. Yes.
Yes, I'm
Let
gonna
me-
start the stopwatch. And
Okay,
if you're
great.
ready, you can go.
That's great. Wow, 3 minutes. Hi, my name is Dr. Yulin Schwen. I am an associate professor actually at the University of Maryland. So I just got recruited to be a distinguished AI professor in the new Artificial Intelligence Interdisciplinary Institute at Maryland. So I'm in the computer science department, and I'm actually going to be representing the School of Public Health and all forms of AI for Maryland. So that's great. So my research highly focuses on health disparities, but using AI methods and untraditional data streams such as digital data, search queries, anything related to the internet. So anything that you tweet, or I guess it would be X now, Instagram, I collect to better understand people's real world beliefs. And I believe that that really translates into real world behaviors. I think that I would be an excellent candidate for 40 under 40 because a lot of my research has actually been highlighted as transformative. For instance, in 2022, 2 of my papers actually were considered the most transformative. It was out of, they selected 10 papers globally by the Robert Wood Johnson Foundation, and 2 of mine actually were selected. So one was on looking at how words matter. So looking at how when President Trump tweeted the term Chinese virus, how that spread and how that led to anti-Asian rhetoric. And the other one was looking at big data for health equity and adding the term, the 5th V, which is virtuosity, which is the importance of ethics. And lastly, I can send it to you, but I recently published an AI-wide checklist. And that checklist is to ensure AI is integrated equitably and ethically across the global environment. And so I brought together experts from countries around the world to develop this checklist so that when you are developing AI interventions, that these AI interventions are deployed in an ethical manner. So they're transparent, the teams are diverse, we are ensuring accountability, and that the data is actually representative of the populations that you want to study. And I have 20 seconds left to say thank you very much to Dr. Circe Gray-Lecomte and Dr. Candace Carpenter. So thank you so much.
Wonderful. So I'm going to unleash the cats. This was our warning. And this is for everyone, including Dr. Schwen, for presenting.
And everyone stayed too. Everyone.
Oh, wow.
I said in the chat, I just love how public health folks, like, we all support one another. And Dr. Schwen also put you back to being an attendee. So there you go. So thank you very much for everyone, just for an incredible session. We're going, as Dr. Carpenter said, we're going to be having at least one other session for 40 under 40. We had a number of people who weren't able to join us today, but rest assured, be growing the cohort and look forward to hearing those. But I'm telling you, the next group is going to have a lot of competition. So for sure. And we'll be sending out everyone's certificates for today as well.
Awesome. Thank you so much.
Fabulous. Bye, everybody.